health and a little wealth and a lot of love.
You have to take charge of your health and your wealth. You can't just leave it all to hired help. You can't leave it to your physician. You can't leave it to your doctor, your nurse. You can't leave it to your financial advisors, your CPA. Ask the right questions. If you ask the right questions, that puts people on their toes and they're going to help you or be willing to help you. Now, there are boundaries there. I'm not saying be, I hate to say it, but a Karen with it. Not my poor mom who I love, but like a Karen with it. But you want to have educated information so you can guide and empower yourself to make these decisions.
Yeah, we can talk about, I didn't really mention the main side effects, and these are different for everyone, but I would say the majority of patients who have side effects, if they do, some people tolerate them just fine and don't have side effects, but they're usually the GI or the gastrointestinal or the stomach side effects. So some nausea, some maybe worsening heartburn or reflux, some abdominal bloating, the, loose stools. Some people have the opposite. Sometimes people have constipation. And so those are the things that we watch out for the most. They tend to be more prominent when people first start the medication or when you're adjusting the doses of the medication. But obviously, if you have severe forms of those side effects, then it either is important to either stop the medication or decrease the dose or avoid going up in the dose. So those are the main things. But I know some of the functional medicine specialists or some of these podcasts that I've heard, they talk about small bowel obstruction and some of the more severe side effects. And we don't see those a lot. And I think we see those more in people who have maybe a lot of other comorbidities, people who have...
What is that?
Or a lot of other health problems, especially in people who have more progressive diabetes, where they've had diabetes for a long time,
Right.
because
Okay.
over time, if your blood sugars are really high, they're kind of wreaking havoc on a lot of different organs in your system. And so you're already having problems with your digestive system running the way it should be. And so those are people that I think it's important to be more cautious with. But a lot of people, if you're using it as a way to prevent progression of a chronic disease, or you have a really bad food addiction and you've tried everything and you just can't move forward and you can't get the goal that you're trying to get to, I think they can be very effective.
That's powerful. So just to summarize that back to you, you strongly recommend these to your patients who struggle. I know something that's helped you in the past is seeing a specialist around your hormonal acne and having that ability so they can help you in something you couldn't control. Same thing with food addiction. I think food addiction is a real thing, or you're trying to lose weight, you tried every single thing. And we've seen people in our circle who've lost significant amount of weight, who've tried every single thing you can think of, diets and exercise and weight loss. And by the way, I'm not saying you have to lose weight to feel good about yourself. We're just saying that if you want to change something about you and you have the resources to do it, this is the opportunity.
With a little health and a little wealth and a lot of love, that's the life that we live. Suits and scrubs.